So one of the big questions that I get as a palliative care specialist is really, what is palliative care? And how is this different or the same than some of the types of care that we're already providing for patients with advanced diseases? I think, as many of you may know, that palliative care is a specialized type of medical care which really focuses providing relief from the symptoms associated with a serious illness like cancer, heart failure, dementia, focuses on symptom management of pain, and on the stressors of a patient, both psychologically, spiritually related to that illness, and it is whatever the diagnosis is. And that providing palliative care is appropriate at any age of a patient and at any stage of their illness. So I take care of patients at stage 1 disease up through stage 4, patients with class 1 heart failure to class 4 heart failure. And palliative care as a type of care is provided together with curative intent therapy. I'm currently involved in a clinical trial where we're providing early palliative care for patients with acute leukemia, and we're doing that while they're getting curative intent chemotherapy, with an eye on trying to help them earlier in the stage of their illness. And really the goal of providing palliative care is to improve the quality of life for both the patients and their families, because this oftentimes directly affects the family unit while patients are undergoing treatments for serious illness. And palliative care can be things like end-of-life care, though in our health system, hospice, which is a form of palliative care at the very end of patients' lives, is a specialized type of palliative care at the very end of life. But a lot of the treatments that we provide are intended to help with symptoms, not intended to cure. And so any treatment like chemotherapy, radiation, diuretics for heart failure are oftentimes just a palliative intervention for helping symptoms associated with a serious illness. And I use this cartoon to just highlight that palliative care and curative care aren't separate doors which we walk our patients through, but are things that we can do together to help focus on their quality of life. And one of the really big models that we are trying to change the paradigm around care is that the goal isn't just to provide life-prolonging care and then at some point we stop doing that and then provide end-of-life care services. It's that when somebody gets diagnosed at that point there, that node of diagnosis, is that we will oftentimes at the very beginning be providing aggressive life-prolonging therapies. Some patients may need some psychological support around the diagnosis of a serious illness like cancer. But over time, as the illness progresses, the need for more intensive symptom management, psychological support will increase. And so that type of palliative care services will increase over time until someone needs an end-of-life care service or specialized palliative care at the very end of life. And then we continue to follow patients and their families primarily after their loved one has died through bereavement. And so this is really the model that we've adopted in the care of our patients, particularly with advanced cancer.